Hi everyone, my name is Mimi Pham. I am a post-grad year 1 pharmacy resident here at Cone Health, and these are the virtual pharmacy updates for March 2021. In this video, we'll review the updates for blood pressure management within the KDIGO guidelines. We'll then review two new FDA drug approvals for Zegalogue, brand name for dasiglucagon, and Astaris, brand name for a combination product of serdexmethylphenidate and dexmethylphenidate. Next, we'll review a couple of FDA updates regarding international unit conversions of supplements and a warning release by the FDA regarding CBD products for pain control. There are also new additions to the Cone Health formulary of long-acting reversible contraceptions, or LARCs. And lastly, we'll review two literature updates regarding bisphosphonates and levothyroxine. First, for guideline updates. Since the last KDIGO guideline update in 2012, evidence from the SPRINT and ACCORD trials have been released and warranted changes in the KDIGO guidelines regarding blood pressure management and blood pressure targets in chronic kidney disease patients. There is a new chapter in the KDIGO guidelines, Chapter 1, that includes recommendations on how to measure blood pressure in adults with CKD. The key recommendation is the use of standardized office blood pressure measurement for the management of high blood pressure in adults. Details in Chapter 1 includes how to properly prepare patients and techniques for measuring blood pressure. And another new chapter, Chapter 2, addresses lifestyle interventions for lowering blood pressure in patients with CKD not receiving dialysis. This chapter focuses on dietary salt restrictions, limiting daily sodium to less than 2 grams, and the new recommendation of 150 minutes a week of moderate intensity physical activity. Chapter 3 of the updated KDIGO guidelines address target blood pressures for patients with CKD with or without diabetes not receiving dialysis. The guideline recommends targeting a systolic blood pressure of less than 120, and the use of an ACE inhibitor or an ARB is recommended in patients with high blood pressure, chronic kidney disease, and moderately to severely increased albuminuria with or without diabetes. Chapter 3 also recommends against the concomitant use of an ACE inhibitor or an ARB with a direct renin inhibitor such as aliskiren for CKD with or without diabetes. Next, in Chapter 4, the guidelines target a systolic blood pressure of less than 130 and a diastolic blood pressure of less than 80 in kidney transplant patients. And if these patients were needing blood pressure lowering agents, a calcium channel blocker or an ARB is recommended as first line. Chapter 5 recommends a 24-hour blood pressure lower than the 50th percentile for age, sex, and height in children with CKD. Next, new FDA approvals. Zegalogue, brand name for dasiglucagon, is a glucagon analog that is formulated in a ready-to-use solution for subcutaneous administration and was approved by the FDA on March 22, 2021, and is expected for release in the U.S. this June. It is indicated to treat severe hypoglycemia in patients and children over the age of 6 with diabetes. It comes as a 0.6 milligram per 0.6 milliliter single-dose auto-injector and as a single-dose pre-filled syringe. In 3 double-blind placebo-controlled phase 3 trials in patients with type 1 diabetes, the Zegalogue group demonstrated a recovery of plasma glucose within 10 minutes compared to 30 to 40 minutes with placebo. The most common side effects observed were nausea, vomiting, headache, diarrhea, and injection site pain. Dasiglucagon is an analog of glucagon, which are products within Baqsimi, the intranasal glucagon powder, and Boki's HypoPen and pre-filled syringes. Next, Astaris, approved on March 2nd of this year, is a combination product of serdexmethylphenidate and dexmethylphenidate that is indicated for ADHD in patients 6 years and older. It is currently the only product that includes serdexmethylphenidate, a prodrug of dexmethylphenidate. Each capsule consists of 70% of the slow-releasing prodrug and 30% of the immediate-releasing dexmethylphenidate. There has not been any head-to-head trials of serdexmethylphenidate with any other ADHD agents that are currently on the market, but in clinical trials, Astaris significantly improved the impairment scores when compared to placebo. The most common side effects observed were GI issues, insomnia, decreased weight, and anxiety. Up next for FDA updates. Following the FDA amendments to nutrition labeling in 2016, nutrition labels of supplements are now in milligrams instead of international units. For vitamins A and D, labels must include units of measure in micrograms instead of international units. The measurement of niacin must be in milligrams of niacin equivalents. For vitamin E, the unit of measurement was changed from international units to milligrams of alpha tocopherol. And for folate, the unit of measurement was changed from micrograms to micrograms of DFE, or dietary folate equivalents. In this table on the slide, you'll find the conversions for each of the mentioned supplements. The FDA had also released a new warning regarding CBD products that are labeled for pain control. These CBD companies are not allowed to bypass the labeling requirements listed by listing CBD as an inactive ingredient and were also removed from the market. Cone Health is also adding 3 long-acting reversible contraceptives to the formulary, Kyleena and Mirena, which are levonorgestrel-containing IUDs, and Paragard, a copper-containing IUD. These will be in addition to Liletta and Nexplanon, which are already on our formulary, and all products are to be stocked in pharmacies and surgical areas within the hospital. Lastly, some literature updates from this past month. Recent trials evaluating the efficacy of providing a bisphosphonate holiday released evidence that suggests a drug holiday to reduce the risk of hip fracture is not needed. In a trial from 1997 to 2009, the use of bisphosphonate was compared between 5, 7, and 10 years. There were no significant differences in hip fractures in patients using bisphosphonate for an additional 2 or 5 years. The decision to initiate a drug holiday should be evaluated after 5 years of continuous use. However, in some patients with severe disease, extending use beyond 5 years do not increase the risk of hip fractures. Recent literature also addresses the administration of levothyroxine. It is commonly known that levothyroxine should be administered 30 to 60 minutes before the first meal of the day in the morning. However, patients have the option to take levothyroxine 3 to 4 hours after their last meal in the evening after their stomach has emptied. Also, biotin, a supplement over the counter commonly used to strengthen hair, nails, and skin, has been shown to produce false hyper and hypothyroidism, depending on the brand of testing equipment. Levothyroxine also has many interactions. Concomitant use of agents like glucocorticoids, amiodarone, and lithium can decrease the release of thyroid hormones. Estrogen derivatives can increase the amount of free thyroid, and agents like calcium carbonate, citrate, and acetate may decrease the absorption of levothyroxine. Agents like carbamazepine and phenytoin can increase the metabolism of levothyroxine, and due to these many possible interactions, a thorough review of patients' medications and how they take their levothyroxine is vital. In summary, during the month of March, KDIGO released updates to their guidelines regarding blood pressure management. 2 new products were approved by the FDA, Zegalogue for severe hypoglycemia and Astaris for ADHD. The FDA released 2 updates regarding the conversion of international units to micrograms or milligrams for more consistent labeling of dietary supplements. The FDA also released a warning against CBD products advertised for pain control. New long-acting reversible contraceptives, or LARCs, have been added to the Cone Health formulary. And lastly, bisphosphonate use beyond 5 years was shown to not increase the risk of hip fractures. And as a reminder, levothyroxine interacts with several commonly prescribed products, so a thorough medication reconciliation and/or review is important. Thank you all. This concludes the Pharmacy Virtual Updates for March 2021.